Hi, it's Dr. Jabor with Cosmetic Surgery Laser Center of El Paso. Today we're performing a rhinoplasty. So the patient's already asleep on the table. Main thing for her is going to be removal of this dorsal hump. May also do some work on the tip to help sort of narrow and refine it a little bit, but those would be the two main things. So she's already been anesthetized with local anesthesia, and I've already actually removed a strip of the septum, which is the middle partition of the nose. So now we're ready to do the osteotomies, and we're going to do a push down technique. So instead of shaving here, I'm going to push the whole subunit down, and you'll see what that will do here in just a sec. Okay, so we're back. So I'm going to put the cut on the bone. See, on this opposite side, it's going to be right along there, and then I'm going to put one here to join it. So there's a cut all the way there, and then on the middle, it's been removed so we can push the whole nose down. So my assistant will tap, 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 tap. And it's a controlled cut on the bone. It's not people, this is what people say breaking the nose, but it's not just a hammer hitting the nose. Tap, 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 tap. You can hear the different thicknesses as it goes through the bone. Tap, 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 tap. A little lighter, tap, 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 tap. Okay, so that's got this cut here. I'm going to draw it on this side here just so you can see. So what I did on the other side was basically something about right there. So I still have this bridge here, so I'm going to make this cut on this side, and then we'll connect it with a bridge osteotomy right here, and then I'll show you as we push the whole subunit down. Okay, so I went ahead and did the push down. I didn't show that part, but you can see how much the dorsum has been brought down. So you can see the profile significantly lower the whole profile of the nose. So the only thing that really I need to do now is just work on the tip and kind of refine that a little bit, take out a little bit of this bulbousness, and we'll be done. Okay, so you can see we're done. We've definitely lowered the dorsum of the nose, and I've also narrowed the tip as well as defatted to remove some of the fat under the skin of the tip. And you can see what, you know, how much of a reduction we have in the dorsum and then the tip of the nose. So from here we're going to put a splint on, and she'll go to recovery room and she'll go home. And then I'll see her in about 6 days in the office to remove sutures. I'm Dr. Mark Jabor, Cosmetic Surgery Laser Center of El Paso. Thank you for watching.
Hi, I just wanted to show you a diagram to have more explanation of the procedure that we just performed. So here is a diagram of something that's called the push down technique. It's one that I do a lot of now, and it's basically for the reduction of the dorsum, or the bony hump in the nose. And what it does is it removes the inner division of the two nostrils, the septum, a piece of that, and puts cuts. The amount of reduction of the dorsum that you get is basically the amount of cartilage that is taken out. So think of it as like analogous of a house that has a pitched roof. You can shave down that pitched roof and it's going to decrease the profile. Or if you took down all 4 of the sides of the house, the roof is going to come down too. So what we're doing is we're taking down the sides to essentially lower the roof. And the advantage of doing that is that there's no violation of this dorsum itself. I've rasped for years, and I can tell you that there's not one person that you can't feel some sort of irregularities afterwards. Also, depending on the size of the dorsal hump or the bump, if you rasp down to a certain degree, you can also cause breathing problems. With this whole subunit here has stayed intact. That's one of the reasons why I've, for the most part, converted over to this push down technique. One other thing that I always do is I draw out this diagram after surgery, and if I ever need to go back, it lets me see what exactly that I've done. And so this is the diagram that I draw out. And so it shows again this cartilage that had been removed here, along with a cut in the bony septum. And then for the tip, I removed small pieces of the cartilage here, used sutures to bring it together. Those were the cuts in the bone. And then one last thing I did on that patient is I removed a little bit of fat from the tip of the nose, what's called defatting the tip. On people who have thick skin, there's really no way of changing that. However, you can remove some of the fat below the skin, and that can thin the skin a little bit and give more of a sculptured look to the nose. So those are the things that I've done. I just wanted to spend a couple of extra minutes showing you that, so hopefully that made a little bit better sense. With rhinoplasty, it's difficult to see. Even if you're a assisting surgeon, it can be difficult to see because the space is so small. So with this, I hope that gives everyone a better understanding. Again, Dr. Mark Jabor, Cosmetic Surgery Laser Center of El Paso. Thank you for watching.